They went at it, doggy style. I had to tell them to stop. I needed to monitor the baby. Guy dresses up while the woman gets back on the bed. Not 20 minutes later, they're at it again. I had the guy leave. Then, the woman's husband shows up. Good day, folks. This is We Ask Reddit, bringing you crazy answers to very interesting questions. Curious as how others answer these questions? Then how about you subscribe to the channel? Being a nurse can be very stressful. Doesn't help that there are times when they catch their patients trying to relieve some of their stress. Today's question is, Nurses of Reddit, what is your most not safe for work story? Now then, let's get into answering. It was my first time in the operating room, shadowing a surgeon. I'm not a nurse, but it's still relevant. The first surgery of the day was a fat graft. It's where they liposuction fat tissue from the patient's belly, then inject it to another site, generally to fix a deformity or scar. In this case, the patient, a very large 45-year-old woman, had had a tumor removed from her butt, which left a big void. The fat graft was to fill it in and give her butt a natural shape. She was under general anesthesia for the procedure. The surgery goes fine, but the last step after they inject the fat into the site is for the surgeon to use his hands to push on the injection site to move the fat around into the right shape. Basically, he's aggressively massaging her butt. Looks weird as hell, but it really was a necessary step. The surgeon finishes, nods, says, "Looks pretty good to me," then proceeds to spank the shit out of the unconscious patient. I'm absolutely stunned. This is my first time watching surgery. I have no idea if that sort of thing is normal. I'd gone in assuming you were always respectful to the patient, who's in the most vulnerable position that's possible to be in. Looking around, much to my relief, everyone else in the room looks just as horrified as I feel. After a moment, the rotation nurse says very softly, "You shouldn't have done that." The surgeon tries to sort of laugh it off and says, "I guess it's a good thing the patients are unconscious, huh?" The nurse didn't even blink. "No, you seriously should not have done that." With that, they finished up, wheeled the patient out, and it was done. I find out later that immediately afterwards, the rotation nurse reported the incident to the hospital administration. The surgeon, who was a senior attending at an elite hospital, wound up getting officially censured and had to take some class on how not to be a complete shithead in the OR. He was on his best behavior for the rest of the time I shadowed him. To make a long story short, surgeon spanked an unconscious patient. I guess those classes should be mandatory now. He must have thought it would be funny for the people shadowing him. I guess he saw it wasn't. This didn't happen to me, but I was working when it happened. A guy in his mid-20s was admitted to a telemetry unit for observation. We're all sitting around the nurse's station around 1 a.m. when the monitor starts alarming and his heart is in V-fib. His nurse, who was very young and very religious, rushes to their room to find him and his girlfriend having sex. It obviously wasn't V-fib. I think the nurse was more embarrassed than the patient. That's a pretty interesting situation to get caught in on. I don't wear panties when I go to work, cause it's more comfortable. I got you. I also feel more comfortable when I don't wear panties. Boxers are fine. L&D nurse here. I had a patient in early labor and she had to wear the fetal heart rate and contraction monitors. Everything was going fine, but all of a sudden, the monitors weren't picking up correctly. I go to the room to help adjust them and I walk in on her, ass naked, on all fours, going at it doggy style. After my initial for fuck's sake gasp, I have to tell them to stop because I need to monitor the baby. Dude grabs his clothes, go to the bathroom to dress, while she gets back into bed. Not 20 minutes later, monitor stops picking up. I go back in, and they are at it again. Same routine as the last time. Back in bed, dude gets dressed, This happens a third time. I have to call the doctor to explain what's going on. Doctor swings by to check on her, and while I'm in the room, charting as the doc does her thing, the doc gives me a weird look. I assume it's because the nurses have all been talking about my horny non-compliant patient, and it's funny. We walk out of the room, doctor grabs my arm and tells me that's not her husband. Few hours later, the guy had left, hubby shows up, and she delivers, and that was that. Like it never happened. Why did this happen? At least the guy's could help with the squeezing out of the baby, I guess. I'll never forget the time a nurse complimented my ass when I was doing chest compressions on a lady whose heart stopped. Well, I guess your ass was to die for, eh? A drunk, abusive woman in her mid-40s stripped herself naked and masturbated in our emergency department. When the police were arresting her, they all jumped back as she wiped her with a pair of gloves and threw them at me. The gloves went splat on my chest and stuck to me. The stink was horrific. I couldn't bring myself to lift my top off, so I cut it off with scissors rather than lift the dank over my face. Good times. I can't do it just imagining the smell. I'm okay. Seriously obese patient famous for making incredibly rapey comments towards male staff. At any rate, she started dating a frail guy, or at least he was spotted making countless trips from the snack machine to her room. A few weeks into the relationship, her sister demands a private room so that they can get their squish on. However, that's not all she wanted. She was concerned that the two couldn't actually consummate their relationship, and she wanted us to...
You just gotta, put them together. She can't hold her legs up, so you gotta hold them for her. Then you gotta help her move. Don't you know nothing?
Oh God, I'm gonna be sick. This is giving me the heebie-jeebies. Had a guy in his late teens, early 20s, constantly masturbating. Everyone walked in on it. It was on a floor where the patients were separated by curtains too. Looking back, I think he was an exhibitionist and he was making us all subjects to his masturbatory fodder. So that was fun. Hey, probably figured that you guys have seen worse. Easy victims. Smart guy. Woman giving her husband a blowjob. Except that she was the patient in a burn unit. Admitted after a flash fire from pouring lighter fluid on her barbecue. All the hair on her face was singed off. Her face was super swollen and red, and we had caked on antibiotic ointment all over her face to treat her burns. Talk about sloppy head. Hey, that could only mean that her husband is such a great guy. He loves her even after all that. Worked labor and delivery one night. This younger, about 16, 17, girl was in labor and had pregnancy-induced hypertension. She was in the room with her boyfriend when we heard him scream. We ran in there to find her giving him a blowjob, which isn't all that unusual in hospitals. But see, here's the thing. If blood pressure gets high enough, people will have seizures. And when people have seizures, they tend to bite down very hard. We had to basically pry this girl's mouth away from his penis. Ow! No! I mean, you can still stitch it back, but still. Not a doctor or nurse, but I'm a police officer. We were going to calls at a hospital for a dispute. Waking through the halls of the hospital, I heard someone yell, "Officer, help! Help!" I walked into the room that the yelling came from, and there was a little bald fat man masturbating violently and just looking deeply into my eyes, snickering. He tricked me. You sound offended. Would you rather he took you out for dinner first? Walked in on a patient's wife giving him a hand while he had a catheter in. He looks at me and says, "Son, you never waste a hard on." And the wife was like what? Soldiering on? Wise words though. Gotta follow that. 15-year-old male with abdominal pain. His cardiac monitor starts stinging. VTAC. Looked convincing on the ghost monitor too. About 3 nurses and a doc caught him masturbating. Hey, if you gotta go, you gotta go. Not a doctor, but paramedic that spent time working in the IMCU early in my career. I was monitoring patients' telemetry, basically like watching an EKG for 12 hours, and noticed our recently tracked and a hole cut in his neck to allow him to breathe. Patient's heart rate was increasing, and he was having abnormalities in his EKG that were not resolving. Paged the nurse, and she knocked on the door, and upon entering, found his wife riding him hard. She was like a deer in headlights and then slowly backed out. It was hilarious. Definitely was not expecting the guy's wife to be having sex with him while he has a new track. But hey, that's love. Hey, pro tip, you can spice things up with S&M choking if you put your finger on the track tube. No poles in the patient's room, but that didn't stop them from getting a lap dance from a lady who was clearly not wearing the nurse's outfit because she worked there. Definitely haven't watched this in a movie. I walked in on 2 ladies, getting it on. I apologized, told them I'd give them a few minutes to finish up and come back later. Ooh, such a gentleman. Well, good thing you didn't go with the pretend I'm a plant route. Would have been rude and creepy. Working in neuropsych, the strangest thing I have ever walked in on was a fully cognitive 18-year-old male having sex with his biological mother. The sex was consensual and they both seemed to be enjoying themselves. However, needless to say, the mother was denied private presence and given limited visiting hours after that. I don't know how to react to this one. Being denied a private presence makes a lot of sense in this case. I am a student midwife. One of the midwives I have worked with walked in on a couple having sex in a private room in an attempt to induce labor themselves before the doctors could get at them. They didn't even notice. That doesn't sound like a medical procedure though. You'd be very surprised at how much old person is going on. Most of the time, it's when a man is in the hospital and his wife comes to visit him, they just climb right into those beds and get freaky. God bless the horny geriatric bastards. Well, that's just sad. This old man seems to be getting more action than I am. Paramedic in Germany. Last week, we got a call to pick up an elderly lady from the hospital and drive her to another hospital to get her TEP, hip replacement, put in. We walk in, she's there with a young guy she introduces as her great-nephew, and who helps her put her stuff together. We tell her to pack up, go get paperwork started, and I go back for her to sign the transfer papers, insurance mostly. Knock, open, she's on the bed, playing with herself, and s***ing off the guy who's standing next to it on his tippy toes so he can reach her. Did a double take. Told the guy that he could press the button to lower the bed so he didn't have to stand on his toes. And gave them a few more minutes. That's a helpful tip for other troublemakers. I hope he really wasn't her great-nephew. That's all for today, folks. We at AskReddit work very hard to make a video every day. So make sure to subscribe to the channel for more videos like this and hit the bell icon to get notifications of our posts. See you on the next one.